Very good.
Okay.
Go ahead.
Hi everyone, this is Kristen Coppins with Spectrum Health. We are here today with Dr. James Fahner, Chief of Pediatric Hematology and Oncology at Helen DeVos Children's Hospital. We're here to chat about Childhood Cancer Awareness Month and the things that the Children's Hospital offers to the community. Thank you so much for joining us today.
My pleasure. Thanks for having me. How are you?
I'm wonderful.
Good.
Thank you.
Good.
So tell us a little bit about what the Hematology and Oncology program offers.
We are very, very proud of our team here at Helen DeVos Children's Hospital. The Children's Cancer Program has really been a fundamental part of the Children's Hospital almost since the very first days of the Children's Hospital.
Right.
And we are excited because we're able to offer, as a comprehensive team of professionals, care for children, teenagers, adolescents, young adults with virtually every diagnosis of childhood cancer or very serious childhood blood disorder. We have physicians on our team, physician extenders, but also a very comprehensive team that includes nurses, social workers, pharmacists, child life specialists, technologists, and technicians who all work together and who've all come together because of their passionate commitment in caring for kids with cancer.
Mm-hmm. That's wonderful. So it is Childhood Cancer Awareness Month.
It is.
So tell us a little bit about the history of the program and how it came to be. I know last year you celebrated 25 years.
We did.
So that's wonderful.
Thank you.
So tell us how you got to that point.
It was our anniversary year last year, 25 years of serving the community, and it is truly a community effort. We're so grateful that we've been embraced over the years by Spectrum Health, by the Children's Hospital as really one of the cornerstone programs. But more importantly, we know that our mission is defined by the patients and families of our communities that we serve, and by the pediatricians and the family physicians who entrust their children to our care, which is very important to us. So over the years, we've grown tremendously from a very small startup organization now to one of the largest children's cancer programs in the Midwest. And we're very proud of the accomplishments that we've had over the years. We've added subspecialty clinics and specialty areas to care for children with sickle cell disease, with blood clotting disorders, with brain tumors. We have our ACT clinic, which is a wonderful program because it celebrates our graduated patients, our success stories who come back now for their aftercare and transition planning. So all these new programs that have been added over the years to just kind of increase the depth and the breadth and the comprehensiveness of the services that we can provide.
That's wonderful. So tell us a little bit about you. How did you get into this career, and what do you like the most about your job?
I think it is absolutely one of the most rewarding specialties that one could go in. And when you first mention to people that you care for children with cancer, sometimes you can see that they're taken aback because those are two things that we never want to hear in the same sentence, children and cancer. And yet the reality is that childhood cancer remains the leading cause of death due to disease in children between the ages of about 3 and 14. Now that's a very sobering statistic, but despite that, we are really in the midst of seeing one of modern medicine's true miracles in what we're able to accomplish in caring for children with cancer. We've seen incredible increases in the successful treatment and in the cure rate for virtually every form of childhood cancer. So when I first started my profession, now almost 30 years ago, many of the diseases that we cared for realistically were almost certain death sentences.
Sure.
Now we're able to tell families and reassure them when their child is diagnosed that we see cure rates of 75, 80%, 85, 90% cure rates for some of the more common children's cancers. So we've really turned around the situation of great despair to one of incredible promise and hope for these children.
That's great. So speaking of advances in treatment and cure rate, what are some of the future technologies or treatment options that you're finding?
It's a great question because we know that despite those incredible treatment advances, we want to continue to refine and improve our therapies. When I meet a new family and when we have a newly diagnosed child, we're able to tell them that they have an excellent prognosis and a very good outlook. But that's after 2 or 3 years of very, very rigorous, difficult therapy. It's a long and arduous journey for a family who's caring for a child with cancer. Many, many weeks and months of visits to the clinic, of chemotherapy, of procedures, of surgeries, perhaps radiation. So we know that there's a lot that we still want to improve on. One of the exciting things that we're doing in that regard is called personalized medicine or precision medicine, the ability to predict precisely for that individual child what is the best therapy and the least toxic therapy that we can offer them. And one of our hallmark programs in that regard is our program with Dr. Giselle Scholler, the neuroblastoma treatment program. She's an extraordinary young clinician scientist who has joined us here at Helen DeVos Children's Hospital with her national consortium. It's called the NMTRC. It's about 25 or 26 different children's hospitals around the country who have all come together to tackle what continues to be one of the most challenging children's cancers called neuroblastoma. She now has a number of protocols in precision medicine where we analyze the actual genetic component, the genetic underpinning of the cancer in each individual child to choose the best specific treatment for that child. And it's showing some very, very promising and some exciting preliminary results. So much so that Dr. Scholler's program is now known and sent patients from not only around the country but literally around the globe. We have children here in our clinic at Helen DeVos in Grand Rapids, Michigan, who travel from Ireland, from the United Kingdom, from Spain, from Germany, from Israel to receive their therapy care.
That's wonderful. It's inspiring.
It is inspiring.
So what can a family expect to experience when they come here? What kind of process do they go through? I know that it can be a very frightening diagnosis to a family. So what can they expect?
I think what I'm most proud of is to be able to reassure families of a couple of things. First of all, that they are surrounded by this dedicated team of individuals who are just passionate about their work in children's cancer. And so the nurses on our inpatient unit and here in our chemotherapy clinic, the pharmacists who their whole focus is on always providing the best and most safest approaches to chemotherapy for the children. Social workers who work specifically with the family if there are financial issues or family issues. Our child life team that make sure that they restore just a little of the magic and the innocence of childhood in the middle of this chaotic and anxiety-producing situation. We know that we can promise families not always completely pain-free, but as close to a pain-free experience as possible, and we do that through our collaboration with the sedation team. Our pediatric intensive care physicians oversee a program of deep sedation and pain prevention so the children who have bone marrow tests and spinal taps no longer have to endure that without sedation. They sleep through the procedure. They wake up comfortably afterwards. They don't remember any pain. It's really reassuring for the family to know that that's a focus. We also take our Children's Hospital president, Dr. Connors, his goal is to make sure that Helen DeVos Children's Hospital is the safest children's hospital in the United States. And we take that mission very seriously in our program as well. So our pharmacists, nurses, and physicians work together with what we call our triple check system for every dose of chemotherapy that a child receives at Helen DeVos is independently verified by 3 different specialists, by the physician, by the nurse, and by the pharmacist. So before any dose is given, we make sure that that's very safely done.
Right.
We had a question. Have you heard of McCune-Albright syndrome?
Yes, it is. That is not always directly related in our area of specialty, but is one that we often work with in conjunction with our pediatric endocrinology team, our experts in that group, and is definitely an area of interest here as well.
Good.
Great. So, we're showing a lot of awareness for Childhood Cancer Month and doing various things. Tell us a little bit about what's going to round out the month with the Hug the Hospital. What does that mean?
Well, it's a really exciting time for us because we are celebrating these great advances in childhood cancer, but it's inspiring for us to know what we have yet to accomplish, and we do that by taking part in a national commemoration of childhood cancer awareness. And our nurses, both here in the clinic and in the inpatient unit, have helped develop a number of very special activities surrounding that. So we have the city who is lighting up in gold and yellow lights some of the bridges, some of the buildings, because the gold ribbons are the symbols, of course, of the childhood cancer awareness. At the end of September, we're actually on Saturday morning doing a Hug the Hospital event where everyone will turn out in yellow and we'll join together to celebrate the great successes that we've had in caring for children with childhood cancer.
That's great. That's great. And That's going to be on the 26th
Exactly.
of September.
Yep.
So
We hope the community comes out.
Yeah, we hope to see everyone there.
Yep.
What else, in final words, what else would you like the community to know about your program and your team and what the Children's Hospital does?
Well, this has been a special time for me as a children's cancer specialist because actually just a couple of weekends ago, my wife and I were invited to be present at the wedding of one of my former patients.
Oh,
So
amazing.
when you think of children and families who come with very difficult diagnoses, with very uncertain outcomes, but then you come full circle and really become part of that family and walk that journey with them and know that those children will graduate and they will head off to college and they'll be married, and we have some of our former patients who come in to bring their children in, so we're kind of surrogate grandparents in a sense to share those kinds of successes, to get the invitations to the graduation open houses and the senior pictures and the updates from our grateful families. There just is nothing that's quite as rewarding as that, to know that from a situation of great anxiety and very much a life-threatening situation, that life goes on and that these children's lives in fact are filled with tremendous hope, and that hope in turn gives us inspiration.
That's wonderful.
We have one more question here. How would you treat fibroid tumors?
Fibroid tumors are uncommon, fortunately, in the pediatric age group, and so it really depends on the location and on the exact clinical situation. We rely on the input of our surgical teams, of course, to assist us because some initial surgical resection may be appropriate, depending on the exact pathology, which is also very, very important to make sure that the tumor is analyzed as closely as possible to know, are there malignant components? Is there a risk that this particular tumor would either come back or would spread elsewhere? Then we sometimes use additional therapies as well. It's a great question because it underscores kind of an unsung hero on our team, which is our close relationship with our diagnostic treatment areas. Our pediatric radiologists here at Helen DeVos are amazing. They are all very, very skilled specifically in pediatric radiology to help us with the diagnosis. In addition, our pathology team, so if we send a specimen of bone marrow, of a blood sample, of a biopsy sample, these are world experts in establishing the most correct diagnosis, and not only the most accurate diagnosis, but in a very timely fashion. Those are the tools, those are the raw materials that we rely on to make our best decisions about the treatment for that child. And so those are the incredible parts of the team that you don't always see. You don't see them out and about in the hallway. They may not ever meet the child. They care passionately about their work, and when they're reviewing the scans and when they're going over the slides and helping us with the diagnosis, it's hugely important.
That's wonderful.
Hi, how are you?
Well, great. Thank you so much for being with us today. We
My
really
pleasure.
appreciate talking about Childhood Cancer Awareness Month, and we're happy to have Dr. Fahner with us. Tune in to our Helen DeVos Twitter and Facebook pages for more fun things happening throughout the month. Thanks.